It's time again for Health Monitor, the number one program that's so to health, to live a life in its healthiest way, to improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the number one health show, yeah.
Welcome to Health Monitor once again. My name is G.B. Ologi and thank you for finding time to be with us on today's show. All right, want to begin right away with assisted conception part of the show brought to you by trucare fertility clinics. And today, Dr. Ivy is looking at fibroids. How do you take care of fibroids in case you want to conceive? Then after that, on body care, Dr. Joe will continue the series on how to lower cholesterol naturally. Today he's looking at lowering cholesterol, that's the bad cholesterol, with strawberry. Then on health tips, Nika will be talking about the functions of the liver. Okay, so please stay with us so you can benefit from all this information that we are put in place for your health purpose.
It's Health Monitor, the number one health show. It's Health Monitor, the number one health show.
Yeah, welcome back to the show, Health Monitor, your guide to good health. And I want to welcome very specially to the show Dr. Ivy from trucare fertility clinics. And today she's talking to us on fibroids. Dr. Ivy, over to you.
Good day, viewers. You're welcome to the assisted reproductive segment of the show. I am Dr. Omori Ivie. For today, we are going to be talking about fibroid. What are fibroids? What do they do? What do they cause? How do you know if you have fibroid? What is the treatment option for fibroid? I'm going to be putting answers to this question today. So first of all, what are fibroids? What are they? Fibroid, they are benign masses. When I say benign, I mean non-cancerous masses that grow around or inside of the womb. So you have a mass that is non-cancerous growing around or inside of the womb. So, but however, because they are not cancerous, they do not directly harm our health, but indirectly they could cause harm to us. So fibroid, they are usually common in females of the reproductive age group. Females in the reproductive age group are at risk of having fibroid. So what are the causes of fibroid? The cause of fibroid is unknown generally, but there are risk factors to suggest a woman is predisposed to having fibroid. You have obesity, you have nulliparity, you have family history. For a family history, a woman who has, maybe her mother had fibroid, her sister has fibroid, she may be at risk of developing uterine fibroid as well. Then also a woman who is obese, you know, when you are obese, big women, very fat women, they are at risk of having fibroid. A woman who has not had any child before, who is not pregnant or has not had any child, she's at risk of having fibroid, and she's in her reproductive age, she's at risk of having fibroid. Then the black race, for the fact of the black race, you have at higher risk. It's commoner in black women than in white women. So you are at higher risk of having fibroid as well. So if a woman has fibroid, what does she feel? How does she know she has fibroid? What are the symptoms? What are the signs? What are the things that she will say, okay, this may be likely be fibroid? Most women with fibroid may not even know they have fibroid because what we call is asymptomatic. There's no symptom at all. And these are usually smaller fibroids. Women with small fibroid may not have any symptom, or fibroid that are located outside of the womb that is not big, you may not have symptom. Then you have heavy menstrual bleeding. A woman whose menstrual cycle, usually she used to have a normal flow, maybe she used to use like 2 to 3 pads a day. Now she starts using like 6 pads or 1 pack of pad in a day, then you know that there's something wrong. That is unusual. She wasn't bleeding that way. I know this excessive bleeding during her period may lead to shortage of blood in her. Then you have prolonged menstrual period now, prolonged menstruation that maybe she used to see her period for about 3 to 5 days. Now she's seeing it for 2 weeks non-stop. Then you know there's something wrong somewhere. It wasn't like that before. So a woman like that, because of the excessive bleeding, she may tilt towards anemia, that's shortage of blood in her system. Some can be so severe that she may need to even get blood transfused in her. She may need to get blood transfusion because of the severity, and this can harm her, can lead to heart failure from the anemic heart failure. Then as well, she can have dizziness because of shortage of blood, and her heart may start beating faster than it used to. She having fast heartbeat without exercising or doing anything. So this, I said that fibroid do not directly harm someone, but indirectly it can harm a woman. Then a woman with fibroid may also have painful periods, which wasn't there before. Now she starts having painful periods. Then for the very huge fibroid, it may cause pressure symptoms. Like if the fibroid is leaning on the rectum, she may have pain on defecation. If it's leaning on the bladder, she may have urinary retention and frequency because it's pressing on the bladder, and because of that she may have to start easing herself more frequent than she used to, and then she still feels as if the urine has not finished coming out. She may have all of that. Then if it is also resting on the intestine, she may feel bloated, abdominal bloatedness and all of that. I said that it does not directly affect a woman, but you can see from these symptoms I'm talking about now, it can indirectly affect a woman. Then also, fibroid may also cause infertility, especially the submucous fibroid, because when the baby is moving to implant in the womb, the baby is supposed to stay on the womb. He's supposed to stay inside of the womb. That's where God has made for the babies to stay. He's supposed to attach to the womb. But fibroid inside of the womb, which we call submucous, has now changed the line of the womb in such a way that the baby cannot implant on the womb. So it may lead to infertility. Then you can have miscarriage, increased rate of miscarriage as a result of uterine fibroid. But if the fibroid is big, it's just like when you have a sitting tenant and a new tenant. Of course, the sitting tenant has more power than the new tenant. So if the fibroid is already big, occupying space, and the baby comes in, it can lead to miscarriage. So women with very big fibroid may have recurrent miscarriages. But the problem with fibroid is that there's a chance of it reoccurring, because when you operate a woman who has fibroid, you are going to bring out the big ones, which you can see, of course. And then the small ones may be left behind. And when you take out these big ones, opportunity for the small ones to grow. So most times, if a woman has had fibroid surgery, it's advisable that she gets pregnant at least within 1 year after the operation. But if there is still a challenge of getting pregnant and you want to have children, not just because you want to remove the fibroid because of symptoms, but you're trying to conceive alongside the fibroid, then it's time to act very fast so that the fibroid do not develop. Because that's one of the challenges we have faced in our clinic with. A lot of women may have done fibroid surgery. They keep trying 1 year, 2 years, 3 years, 4 years, and they're still trying. At the end of the day, you have the fibroid coming back as if she has not even touched, they've never operated on her. So a woman who is trying to conceive and has had fibroid surgery done, it's better you start working your way towards achieving pregnancy on time. Because there's a saying in medicine that says that a womb that will not carry a baby will carry fibroids. So the earlier you act on it, and the better for every woman like that has that kind of situation, that is in that kind of situation. So I advise every woman out there, if you've had your fibroid operation done, very good. The next thing to do, if pregnancy is not forthcoming naturally, then you should quickly try and do IVF so that you have to carry your babies on time before the fibroid comes back. And if fibroid comes back, you may have to do a second surgery. And most women do not want to hear that they're going for a second surgery, because after the experience of the first one, they may not want to go for another surgery. So I advise every woman who is listening to me today, we may have friends, we may have relatives, we may have church members, acquaintances, colleagues who are passing through this situation. Please spread the word out there. Let them know that there's need to quickly get pregnant if infertility is associated with your fibroid following fibroid surgery. So thank you very much, and I'm happy you're all listening to me today.
Thank you so much, Dr. Ivy, for that piece on fibroids. Please contact Dr. Ivy in case you have this kind of issue so she can take care of it and you can smile with your children.
It's harmony to the number one health show. It's harmony to the number one health show.
You're still on Health Monitor, your guides good health. This is the body care part of the show where Dr. Joe is standing by to take a look on how strawberry can actually lower bad cholesterol from your system. Dr. Joe, over to you.
Hello! Is it possible to reduce your bad cholesterol levels with yummy alternatives? Of course it is. Are there effective statins alternatives? Of course there are. And I've got a great selection for you. So, the train of soluble fiber foods to help us reduce our cholesterol levels rumbles on. It was never going to stop anyway. I've got a great selection of yummy foods that you can actually eat that will help you to reduce your bad cholesterol levels. So, what foods am I talking about? Well, let's get on with it. The principle is that we want to eat foods that have soluble fiber because it is the soluble fiber that is going to make us regular. It is the soluble fiber that is going to attract and bind the dumped cholesterol into its substance and escort it out of our bodies. That way, the cholesterol that has been dumped from the liver does not get reabsorbed into our circulation. That's what soluble fiber does. And here is the soluble fiber in action. You can see it just mopping up the cholesterol from the small bowel into the large bowel, and it just basically sweeps it along and escorts it out of our body. But there is one very important point that you need to take note of, and that is that for the soluble fiber to do its job, it needs to actually form a gel. And that means you have to drink plenty of water to facilitate the transformation of the soluble fiber into the gel form. That is very important. So with that in mind, here are the soluble fiber foods that you can choose from to achieve our goal of reducing our bad cholesterol. Remember, we're trying to find statins alternative. So here we go. The first group of foods is actually beans. Beans are generally rich in fiber and soluble fiber, but black beans and lima beans actually have the highest soluble fiber content. In fact, 130 grams of either black beans or lima beans will give you about 5.4 grams of soluble fiber. That is really, really rich. Next is guava. Guava is a tropical fruit that is rich in vitamins A, C, and B6. 3.5 ounces, which is 100 grams, will give you 1.7 grams of soluble fiber. The next food is avocados. You're very familiar with this. Avocados are rich in monounsaturated fat as well as potassium. Also, they're a good source of both soluble and insoluble fiber. In fact, half an avocado fruit will give you 2.2 grams of soluble fiber, and that's really fantastic. The next food is citrus fruits. Now, we got a huge selection here. You've got oranges, clementines, tangerines, lemons, lime, grapefruits. They're all rich in soluble fiber. In fact, the fleshy pulp is where lots of the soluble fiber actually lie. And unfortunately, we tend to throw this away. So if you can actually gorge on this, you'll be doing yourself a huge favor. Even a small peeled orange will give you 1.8 grams of soluble fiber. Next is sweet potatoes. Sweet potatoes are a nutritious food with diverse applications. Sweet potatoes are really very rich in fiber, and you get even more fiber if you leave the skin on. A medium-sized sweet potato flesh will give you about 1.8 grams of soluble fiber. That's pretty good. Next is okra. Now, this is one food that is not very popular, but I can tell you this is a really nourishing food, and is also low calorie, is rich in potassium, is rich in vitamins A and C. 1 cup of cooked okra will give you 2 grams of soluble fiber. Not bad. Next food is oats and oat bran. Oats have a wide range of applications. Probably one of the best foods on the planet. The thing about oats is that the soluble fiber here is different. It's not pectin. It's called beta glucan.
It does a very good job of lowering bad cholesterol, just as good as pectin does. 1 cup of regular oats will give you 1.9 grams of soluble fiber. Next is barley. You probably know barley for making beer, but it's got richer applications than just making beer. Barley actually has 4 types of soluble fiber. It's got the beta-glucan, the guar gum, pectin, as well as psyllium. Now, 1 cup of cooked barley will give you 1.8 grams of soluble fiber. Next is apples. Of course, everyone knows apples. They're popular. They're everyone's favorite. Apples are very rich in phytonutrients. They may be sweet or they may be tart in taste, depending on the type, but they are a good source of pectin. And of course, you have to eat it with the skin to have all of the benefits. 1 medium-sized apple will give you, with the skin that is, will give you 1 gram of soluble fiber. Next is broccoli. Broccoli is a rich source of vitamin C and K. It's got folic acid, it's got iron, it's got potassium. It's one of the best cruciferous vegetables around. 1 cup of cooked broccoli will give you a whopping 2.3 grams of soluble fiber. Next is Brussels sprouts. You may love or hate Brussels sprouts. It's another cruciferous vegetable that is rich in phytonutrients. You should start loving this bad boy because it could save your life. It's got lots of applications, got lots of health benefits, but from the soluble fiber point of view, 1 cup of cooked Brussels sprouts will give you 3.9 grams of soluble fiber. The next soluble fiber food is plums. Plums are one of the juiciest fruits in the family of stone fruits. They are a rich source of vitamins, minerals, and antioxidants. 1 medium-sized plum will yield 1.3 grams of soluble fiber. Next is flax seeds. Flax seeds are a good source of omega-3 fatty acids. You can use them in your breakfast recipes, your smoothies, your cakes, and your pudding. And 1 cup of flax seeds will give you a whopping 13 grams of soluble fiber. Next is sunflower seeds. Sunflower seeds are a good source of magnesium, iron, selenium, and they have both monounsaturated and polyunsaturated fatty acids. 1 cup of sunflower seeds will yield 2.7 grams of soluble fiber. Our next soluble fiber food that is going to help us reduce our bad cholesterol levels, which will represent a statin alternative, is hazelnuts. Well, hazelnuts are derived from the corylus tree. They can be used as a delicious snack. They are a very popular ingredient in processed foods like spreads and chocolate products. 1 cup of hazelnuts will yield 4.4 grams of soluble fiber. That's also pretty good. The next soluble fiber food that is going to help us reduce our bad cholesterol is millet. Well, strictly speaking, millet is actually a seed, but it does cook like a grain. 1 point to note here is that millet is actually gluten-free and is a nice alternative to wheat. 1 cup of dry millet will yield 3.2 grams of soluble fiber. That's also not bad at all. The next soluble fiber food that we should be consuming is dates. Dates are very popular in the Middle East and North Africa. They have a deep flavor and they are very sweet. So one has to be careful here. You don't want to consume too many dates because 100 grams of dates will actually yield 60 grams of sugar. So even though they have fiber, you don't want to consume too many dates. 1 cup of dates will produce 2.2 grams of soluble fiber. The next soluble fiber food that will help us reduce our bad cholesterol, that will represent a statin alternative, is asparagus. Asparagus are actually the shoots of a lily plant. They are rich in calcium, potassium, iron, vitamin C, and A. In fact, 1 cup of cooked asparagus will yield about 3.4 grams of soluble fiber. That's also pretty high. The next soluble fiber food is parsnips. Parsnips are closely related to carrots and parsley. You can bake parsnips, you can use it in soups, you can use it in stews. 1 cup of cooked parsnip will produce 3.6 grams of soluble fiber. That's also pretty high. So here we have a very nice selection of foods that we can use as statin alternatives.
Yes, I'm probably biased, but I'll say that was a great selection of soluble fiber foods that could represent statins alternatives. The rule is that you have to eat these foods consistently and regularly. If you do that, you begin to see a decline in your bad cholesterol levels.
Thank you, Dr. Joe, and want to appreciate that information on how to lower bad cholesterol. Okay, next time we come your way, Dr. Joe will bring you more foods that can help you lower cholesterol.
The state government is gradually easing the lockdown to allow for minimal movement.
As responsible citizens, we also have our roles to play
in ensuring a safe and secure society.
I would like to encourage you to be sensitive, cautious,
and on guard for your personal state of well-being and others.
Please stay at home if it is not necessary for you to go out.
And if it is important for you to go out,
kindly protect yourselves
by observing social distancing.
Also washing your hands regularly, especially if it's a public place.
And taking your bath before relating with members of your family.
Don't forget to use your alcoholic-based sanitizer.
Avoid sharing of utensils with friends and even family members.
Make sure you take warm water regularly to keep your body warm.
Stay safe, stay at home, keep the rules.
We appreciate the immense contributions of our frontline medical personnel to minimize the casualty figures during this pandemic, while our hearts go out to those who have lost loved ones.
Join the force to beat this pandemic.
This message is brought to you by Electronic Media Content Owners Association of Nigeria, EMCON.
Hello, this is Health Tips segments on your darling health program, Health Monitor, your guide to good health. I am Adenike Famujuro Fakayode, and today we are going to be talking about the liver, which is the largest internal organ of the body. The main work of the liver is to filter the blood coming from the digestive tracts before passing it to the rest of the body. It eliminates toxins, and like I earlier said, it's the largest internal organ of the body. And what are those things that we do that can damage the liver? Number one, too much intake of alcohol can damage the liver. Number two, too much intake of refined sugar, and let's try as much as possible to reduce foods with added sugar such as pastries, soda, and candies. Sugar can be as damaging to the liver as alcohol. Number three, herbal supplements. Herbal supplements that is not okay for you can damage your liver. Consult your doctor before you take any herbal supplement. Number four, weight gain and trans fat found in packaged and baked food can make fat build in your liver cells, and as a result, the liver can swell, and over a period of time, it can harden, which can cause liver disease. Number five, high intake of vitamin A from supplement that you might probably not need can be problematic to your liver. It's okay to get your vitamin A from your fruits and vegetables, especially the red, orange, and yellow colored fruits. Check with your doctor to be sure they are not ingesting too much of vitamin A. Number six, overdose of acetaminophen like paracetamol or medications used to treat mild or moderate fever or pains can be damaging to your liver. Check with your doctor to be sure that you are taking the right proportion of acetaminophen, even if you are combining pain-relieving drugs or medication. Number seven, hepatitis can cause liver disease and it can be spread from an infected person to you. Get your screening done today and be vaccinated. This is where we draw the curtain on health tips today. And till I come your way next time, I am Adenike Famujuro Fakayode. Be healthy and be mindful of your lifestyle.
We want to appreciate Nike for giving us that piece on functions of the liver on health tips today. Let's go for a break now, and Health Monitor will continue.
memories are created daily from events, photo and video shoots. Having the perfect studio, equipment and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Akme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
I want to appreciate you for watching the program today again, and of course, I want to say a big thank you to Dr. Ivy from trucare Fertility Clinics, and not forgetting Dr. Joe and Nika. Thank you for giving us that piece on the functions of the liver. Thank you for staying with us, viewers. I want to catch you again on Health Monitor, your guide to good health. My name is Jibe Ologe, signing out.